I'm presenting the INFINITY-SWEDEHEART Trial, and it tries to address a problem that we have with today's drug-eluting stents. And that is that they destroy the physiology of the coronary arteries by caging the vessels. And that results in event rates up to 10 years. It could be 45% event rates actually. So the DynamX Bioadaptor opens up after 6 months. It has links all through its design, and it opens up and restores pulsatility, vasomotion, and positive remodeling. And our thought is that this should reduce the event rates or complications of drug-eluting stents. So we enrolled 2,400 patients. 77% was ACS patients and 23% was chronic coronary, so rather complex patient population. We randomized them 1-to-1 to DynamX or Onyx, and then we follow them for 1 year. We will follow them longer, but today I'm presenting the 1-year data. First, we show non-inferiority to Onyx. And that is of course very important with a new device on the market and so on. But the really interesting thing is what happens beyond 6 months. So the first 6 months we knew that nothing should be different from a regular drug-eluting stent. But beyond that, we did a landmark analysis from 6 to 12 months. And here is what's really interesting things happen. Then we suddenly see superiority for the DynamX Bioadaptor compared to a regular Onyx stent. And especially here at TCT, we present very special subgroups that are known to have a high restenosis rate and high complication rates. That's for the LED, for small vessels, for long lesions, and for the ACS population. And in all those 4 groups, we see superiority of the DynamX Bioadaptor compared to a regular drug-eluting stent today, from 6 to 12 months. What we think this means in the long term is that we reduce the long-term risk of complications to stenting or using a bioadaptor. And that means that patients will not suffer from long-term complication risks by having a stent placed in their coronaries. If they get a bioadaptor, hopefully we see a plateauing of events and nearly no long-term risks. Yeah, what is mostly needed is long-term data. That's what everyone asks for, and that's the solution we will try to give. So we will report 2, 3, 4, 5-year data as the data comes along. But there are a lot of subgroups you can think about that it could be interesting to look at. You could look at bifurcations, you could look at CTOs, you could look at calcified lesions, you could look at there are long LED lesions and so on. And some of that data we will have in our study already. But in the future you could also do other new studies on selected patient population and groups.